Hi, good morning, good evening, everyone. Welcome to the webinar Preschooling in India Policy Progress and Practice, organized jointly by the Lakshmi, Mittal and Family South Asia Institute at Harvard University and Harvard T.H. Chan School of Public Health India Research Center, both entities of the Harvard Global Research Support Center, India. I'm Monica Setia, India Associate Country Director at Lakshmi, Mittal and Family South Asia Institute, Mittal Institute in short. Thank you so much for joining us today, either late evening India time or early morning US time, or maybe another part of the world at a different time zone. I'm joined here by a wonderful panel whom I'll introduce you shortly, and an invisible but very active team in the background who are ensuring that this webinar is running smoothly. For those of you who are joining us for the first time, I'm going to introduce the Mittal Institute very briefly, and then we'll get into a 50 to 60-minute conversation with our panel. And then finally, we'll give around 20 to 25 minutes for question and answer round with the audience members. So beginning with an introduction to the Mittal Institute, we were founded to further Harvard University's engagement with South Asia. The Mittal Institute engages in interdisciplinary research to advance and deepen the understanding of critical issues that are relevant to South Asia and its relationship to the world. We were formally recognized as a South Asia Institute or initiative as an academic institute in 2013. A little bit about the T.H. Chan School of Public Health India Research Center. We foster strategic partnerships in India, supporting ongoing research, teaching, and collaboration while facilitating the development of new initiatives. You can find more about the work of both our centers at our respective websites. I want to add here that besides Harvard faculty, students, and researchers, Mittal Institute and the Harvard T.H. Chan India Research Center, we work very closely with in-region scholars and institutions through scholarly exchanges and fellowships, lectures and conferences, both at Harvard and in the region, and research grants, building all the while a community of stakeholders who are interested in working on issues that are relevant to South Asia. Speaking about which, I want to inform the audience about our currently open India fellowships. We invite the interested audience to read more about these fellowships and consider applying for them. You can refer to the link in the chat window for more details. And now, moving on with our session today. I've already informed you about the format of the session. I request everyone that when we are about to reach the Q&A session or while the panelists are doing the discussion, if you have any questions, please post them in the Q&A window of Zoom. If you have any audio or video troubles, please check your internet connection and speakers or your device audio settings. But if you continue to have trouble, please post a message in the chat window and our team members will check if we have any issues at our end. With that, I just want to move forward with the core part of our panel discussion here in the session today. As you all know, we have with us four global experts on the subject of early childhood education who are joining us today to engage in a panel discussion with Professor Aisha Yousafzai chairing the session. Aisha is a professor of child development and health in the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. Her research focuses on promoting the well-being of children and the stability of families among disadvantaged and vulnerable populations in low and middle income countries with a special focus in South Asia and East and Southern Africa. Our panelists include Dr. Rukmini Banerjee, CEO of Pratham Education Foundation. Rukmini holds a PhD from University of Chicago, and she received her education from renowned institutions like St. Stephen's College and Oxford University. She has been pivotal in Pratham's educational initiatives and very notably leading the ASER exercise from 2005 to 2014. Her contributions have been recognized with various prestigious awards. Professor Nirmala Rao, a distinguished academic in the University of Hong Kong, holding the position of Serena H.C. Yang Professor in Early Childhood Development and Education, Chair Professor of Child Development Education, and Director of the Consortium of Research on Early Childhood Development and Education within the Faculty of Education. Nirmala specializes in researching early childhood development and education within Asian cultural context. She's highly published, serves on various editorial boards, and has received accolades for her contributions to both research and teaching. Finally, Dr. Pradeep Chaudhary, Assistant Professor of Economics at Zakir Hussain Center for Educational Studies, School of Social Sciences, Jawaharlal Nehru University, New Delhi. Pradeep is an associate of the Mittal Institute, having recently finished his Bajaj Fellowship at Cambridge in Harvard. His research spans in the field of education economics, including K-12 and post-secondary, with his current research delving into access and quality issues in private early childhood education market in India. Pradeep has published extensively in peer-reviewed journals and co-edited a volume on educational studies in India. His upcoming book project with Rutledge examines the effects of the COVID-19 pandemic on education in India. Thank you so much, Aisha, Nirmala, Pradeep, and Rukmini, for taking our time and enriching all of us with your knowledge and insights. Without taking more time, I will turn over to Aisha for her to take forward the session. Everyone, enjoy the conversations.
Thank you so much, Monica. It's a great pleasure to be able to join this panel and to learn from the rich and very deep expertise of our panelists. So with that, I want to begin with a very brief overview or snapshot that sets the scene for this panel, and then we'll dive straight into what I hope will be a very enriching discussion. So if you give me one moment, I will just pull up my slides. Great. All right, so I'm going to begin just by describing what we see globally in terms of early childhood education. So firstly, why does it matter? And why should we be dedicating such a great deal of investment and time in this area of work? Well, firstly, there is a moral and political imperative that is enshrined in the rights of all children to have access to early education. And this really begins even before children ever set foot in a formal classroom. We also know that there is a growing case for economic investment and gender equity. So having affordable access to high quality early education services allows increasing participation of parents, particularly mothers, in the workforce. And that's a win-win in terms of national development. And finally, we also know from abundance of evidence from around the world that early childhood care and education initiatives are effective and they're cost effective when delivered with sufficient quality and with sufficient access and equity. So there's a growing body of literature that has shown that children who participate in high quality programs can benefit in terms of their learning and their development, as well as their health outcomes. So over the last 20 years or so, we have seen an increase in the number of children who are able to access pre-primary education across all regions in the world. But as you can see, whether we're talking about low-income countries or high-income countries, we are still seeing inequities, both across regions, but also within regions. So this leads us to understand that access alone is not enough. Equity matters. So children who live in wealthier households are more likely to attend early childhood care and education services. Children who are in urban settings are more likely to attend early childhood care and education services. And this is similar for slightly older children compared with younger children in this age group. But we don't see at the global level any gender differences, which is good news, at least in terms of access. But again, access is important, equity is important, but quality really matters. And in this panel, we'll definitely be diving more into what we mean by quality, but it is not enough to have a building. We need to ensure sufficient structural quality in terms of the number of children per teacher. We need to think about the resources, but we also need to think about what we describe as process quality, the engagement and the interaction between teachers and their children, if we're really to see holistic benefits for young children's outcomes. So that's an overview, a high-level overview of what we see globally. But in this panel, we're going to take a deeper dive to understand the situation in India. What is the data telling us? How can we better think about promoting equity in access? How do we enhance and strengthen quality? And how are we shaping demands for these programs in terms of demand at the policy level, demands for the programs within families and communities, so that they're receiving not only local services, but of services of good quality and services which are equitable. So with this, I would like to begin the panel really first by asking Rukmini about her work leading the ASA in India. So we recognize this is one of the most significant data sources that tells us a little bit about what's happening across the early childhood period. And so to set the scene, I'd like to invite you, Rukmini, to tell us a little bit about what are the learnings we should take away from the ASA, what proportion of children have access to services, and what are the things that we should be thinking about if we're to improve both access and equity as well as quality. So
thank you, Aisha, for a very good introduction. And I think it's always good to start with a broad view and some, big numbers. The ASER report, the Annual Status of Education report, actually looks largely at what happens to children once they're in school. But right from the beginning, we've been collecting information on where children from age 3 onwards have been enrolled. So looking back, we can look at a lot of trends over time in how this space has been changing. And I wanted to just show a couple of data slides just to sort of anchor our discussion. So let me see if I can do that easily. One second. You can see this. So I've pulled out from the last large ASER survey, which goes to every rural district in India, 2022. And I want to just point out a couple of things. One is, for the age group 3 to, let's say, at least 6 or 7, you can see there are many possibilities of where children could be enrolled. We have the Anganwadi system, which is our government early childhood care and education services. There are government schools which now have a pre-primary grade. Private schools, even in rural areas, and I think this will be of interest to Pradeep, often don't enter children into first grade. They start them in earlier. We call them lower KG or upper KG here in India. But there's also a big push which parents have as aspirations are going up to get their children into school as early as possible. So if you don't have what you think of as a decent preschool, and if you believe that years of education matter, and particularly as parents, if you haven't had the number of years of education you thought you should have had, then the chances that you want to enroll your children into school sooner and earlier, because around you, you see that people who have money are putting their children into all kinds of schools early. So there is a push even early on to get children into government school. So the government school here column means actually standard 1. And then you can see there are other options, private school and not going anywhere. And I want to draw your attention to the age 5, because you look at the different options there are. About a third of all kids in class 5 at age 5 could be in Anganwadi. About a fourth are in pre-primary but in private school, and a fourth are already in first standard. So you imagine if you're a teacher in second standard in schools in India, you're actually dealing with children who've come from very different pathways. And I think that our new education policy, which has come out in 2020, puts a big focus on this fact that children actually could start an early childhood education several years before they come to first standard. And therefore, that whole process, that whole continuum now should be seen as one continuum where we begin to invest as much as possible to get as good quality as possible early on. Now, one more thing I want to show you, which is obvious to anybody who knows India, is that we have huge variations across the country. And therefore, a one size fits all is obviously not the right thing to do. And so I'm showing you just two cases, one from Odisha and one from UP. And I'm showing you just these three age groups, age 3, 4, and 5. And you can see how different the patterns are across these two states. In Odisha, children remain in Anganwadi still quite late, even even at age 5, you have 3/4 of the children going to Anganwadis. And if you look at children who are not enrolled anywhere, that number is very low even at age 3. So coming into the Anganwadi umbrella from early on has advantages, not just of health and nutrition, but even if early childhood education is done with in a small period of time, you still have these multiple benefits. Compared to that, if you look at UP, you see it's a completely different story, where Anganwadi enrollment is low throughout. You see high entry into government school, 1/4 of the kids already at age 5, which I consider to be lower age than ideal, already in government schools, and a large number of children who are not attending Anganwadi or school early on. And so this is just to say that we have a big variation. We need to look in India at our own data to see where are we today before we plan what is appropriate. And I think there are many states where children stay on in Anganwadis till almost age 6, which gives some kind of a signal, I think, that there is something happening in Anganwadis that the parents value. And that way they go Maharashtra, Karnataka, Gujarat, there are Odisha, Chhattisgarh. These are states in which the kids who are going into first standard have largely come from having been in Anganwadi for quite some time. So I wanted to just set the stage to say, there is some very basic data like this that we have over time. And secondly, that there are many variations even for an age group. And third, that we have very varied profiles for our states. And of course, if you look lower down into districts across different contexts that we need to take into account as we think ahead. And we need to think ahead for all the right reasons that Aisha pointed out, but also because our new education policy is really giving high importance to this age group. And therefore, there are opportunities, which I'm sure we'll talk about later, for what can be done in the next couple of years to really bring about a qualitative change in what we can offer our children at this early stage. I'll stop, but I just want to point out that two more things. One is that after 2014, we are doing the big Asar every other year, and we spend the gap years focusing on a particular age group. So the Asar in 2019 looked at the age group from 4 to 8. And I'm sure we will put out some of these links to studies. And that one doesn't go to every district in India, but looks much more deeply at cognitive outcomes, cognitive levels, socio-emotional kinds of quantitative, it is a quantitative study, but done at the household level. And finally, a third one, which was done with UNICEF support by Ambedkar University and Asar Center, which followed a cohort of children for 5 years from preschool to actually formal school. So I think these are the combination of studies that we have. And of course, to this audience, I'm preaching to the choir, the fact that we need to continuously, just as our children are growing, we need to keep pace with them with research and with evidence that can inform what our kids need. And we are in a very dynamic situation. I think that combination of the new education policy and the hit of COVID, both I think have led to, increasing aspirations for what we can do in this age group. So I'll stop there and hand it back to you, Aisha.
Thank you. And I think what you've highlighted there is really that this is a moment of great opportunity in India because of the momentum that's been initiated with the new policy. And so building on some of that and the data that you've shared, I'd like to turn to you, Pradeep, and ask, what political will need to change, it will need to happen to really bring about some of these qualitative changes that Rukmini is referring to, both in terms of addressing this variation across states, even with just the 2 examples that were shared there, but also in collaboration across ministries, because the Anganwadi program is run by one ministry or overseen by one ministry, and then you have the formal education transition in the education sector itself. So what do you think really needs to be happening at the political, at the policy level to really address some of these issues in terms of both access and equity in the early childhood services?
Thank you, Aisha, for raising an interesting question, and thank you all for joining. I think the global discourse and the research on early childhood education has brought several interesting facts in front of us. And you have highlighted a few in the introduction, then Rukmani said a few. Now the research in EC, at least the economists who are looking at this issue, they have clearly said that the returns to early childhood education is one of the highest among all levels of education. So if you invest early, it is true at the family level, and it is also true at the country level. If you invest early on children, so you are the one who will be getting the highest benefit from your investment. So that's very clear. Given that, let me get into the policy discourse a bit and then what India is looking at it. If you look at the SDG, Sustainable Development Goal Target 4.2, it clearly tells by 2030, we should ensure that all girls and boys have access to quality early childhood development care and pre-primary education, by which they will be ready for primary education. So that's the goal of sustain. That is the goal that is being set at the global level. What India is doing, India, to me, when I look India as a case study, so I see that India has missed a lot in the process. But at least the interesting story now is we have back to the track, and at least in the National Education Policy 2020, we have created a discourse on early childhood education. And there is a huge, what you call, this like amount of studies, and also, as I said, discourse has come up in this area. This policy emphasized the benefits of early years of education, which is being emphasized not necessarily in this policy. Before that also, Osar brought out many interesting facts saying that how important it is. But from the government side, this message is very loud and clear, which says that unless we focus at the policy level on early years, it's not possible to come out of the kind of learning crisis that India is facing. Because we have a huge learning crisis that Osar brings us for rural India, and unfortunately, we don't have learning crisis for urban India so far. I don't know whether Rukmani is thinking in that line, because we don't know how slum children are learning. Children from poor families in urban settings are learning. So that's not known to many of us, but at least in the rural settings, what we know from Osar from 2007. So it's very clear that children are not learning, and this is being acknowledged in the national education policy very clearly. What I am finding, even if it is being acknowledged, where we are right now is important to assess. Where we are standing. I think Rukmani said a few tables where we are standing a bit, but I will say a bit on this access and equity concerns in early childhood education in India, because these are very important concerns to know where we stand, where India stands. I analyzed the National Statistics Organization NSO data on education round 75th in 2017-18. Then ASER data a bit on 2020-22, and also we have UDICE data, which is Unified District Information System for Education, UDICE Plus now, which is produced by Ministry of Education. Earlier it was Ministry of Human Resource Development and MHRD. So that clearly tells few facts, and these are important to know. We have only about 30% of the primary schools in India are having pre-primary section, only 30%. 25% of primary schools having Anganwadi centers in the school premises, and half of the primary schools are having either Anganwadi centers or pre-primary sections in the school campus. The second fact is, the data is saying close to 60% of the private unaided recognized primary schools have pre-primary sections. So there is a huge difference between the access to pre-primary sections between government and private schools. Why I am referring that is an interesting fact. I will come in a little while. But this year is only 20% in government primary schools. And of the total student enrollment in pre-primary education in India, more than 2/3, that is almost 67% are in private schools. So mostly the children are enrolled in private schools. Less than 1/3 of the students admitted in grade 1 are having preschooling exposure. Less than 1/3. So this is very less. If you look at the global picture, so India stands at the almost at the bottom, where we say that preschooling exposure to the children who are enrolling in grade 1 is very less. It's an important indicator because it's always being argued. Children who are getting early exposure, they are the one who are doing better, not necessarily in the learning outcome immediately, but also in their earnings in the labor market. So there is a long-term effect of this early exposure to children. If you see, if you add Anganwadis exposure in the government schools, they are getting also the access to private school. So altogether, it adds up to 51%. So it's a good number and it is improving to some extent because of the access to Anganwadi centers largely. So that means around 51% of the children are admitted to grade 1 in private schools have exposure to preschools, while this is only about 20% in government schools. So there is a huge inequality that exists between government and private schools, which is a point that we all must think. I was looking at the National Statistical Office data, the 2017-18 data, that finds that only 20% of children in the age group of 3 to 5 attend pre-primary schools, that is the nursery and KG. Let me clearly tell this. So they don't bring Anganwadis into the picture. This is excluding Anganwadis. So if you exclude Anganwadis, not many children are accessing pre-primary schools. That's an important thing we should think. Because Anganwadis, there are stories that have come up that what Anganwadis really do for the children. They do fantastic jobs in improving institutional delivery, in vaccination, in many other aspects. But the component of early childhood education as such is not present in many Anganwadi centers that I think many of us are aware of. And studies are saying that if you add more workers to Anganwadi centers, if you make some changes in the Anganwadi centers, it is likely that they can bring some component of learning. But right now it is not happening. The message is very clear. So in that context, only 20% of children are going into LKG, UKG, or we call lower kindergarten, upper kindergarten, or nursery. It is excluding Anganwadi. So there is a, with that also there is a huge difference at the sub-national level. For instance, if you see Odisha, it is only 7% who are attending this kind of schools, and it goes to 57% in Goa. Similarly, we have caste lines, we have inequalities. We have only 13% scheduled tribe access to these schools, where it is almost 30% for forward caste groups. In rural, it is 16%. In urban, it is almost 35%. Poorest consumption quintile, that's the poorest households in India, they access 11%, while richest access almost 42%, these schools. Illiterate head of, if the household head is illiterate, then they only access 12%. If the household head education is graduate and above, then they attend almost 40%. So there is a huge socioeconomic disparity that exists in Indian context in access to preschools. You include Anganwadis, the situation improves a bit. You exclude Anganwadis, the situation is very dark, that we can see, because we don't have many options in the government sector. So largely, this preschooling is catering in the private sector. I was also looking at how much households spend on this, because it's not necessarily only about access, it's about how much the households invest in pre-primary education. On an average, I was looking at, again from a National Statistical Organization data, a household spends on an average $10 per month per child for pre-primary education. So it is almost 850 INR per month they spend on household. That means if a child, one child is accessing from one household, that household spends 10 USD per child. That is what the figure. And again, this varies significantly by socioeconomic groups. For example, the children from rural households, they spend 4 USD per month. Urban, they spend more than 10. Illiterate households, like head of the household, they spend significantly low, 6 USD, and graduation and above, they spend 21 USD per month. Similarly, poorest and richest, poorest spend almost 3.5.
I think Pradeep's internet has frozen, but I think while we wait for him to come back online, I want to just pick up on a few things that he was saying, which is, first and foremost, there is still this variation in the access when we look more deeply at some of this data. But I also want to touch upon the point that I see that's coming up in some of the discussion also among the participants of the panel, that you know, there is an emphasis on what what the Anganwadi centers are focusing on versus maybe what the private sector of education facilities or the public sector is focusing on. And so, Nirmala, given this variation and the incredible amount of work you've done on trying to say, once children have access, we also need to think about what's happening, whether they're learning, and that really depends on the quality. I'd love you to share a little bit about what it means to have good quality early childhood education programs. And perhaps I'll also just challenge you a little bit to say, where resources may be constrained, what do you invest in, access or quality?
Thank you, Aisha, for the really very good question. I'm very happy to be here. So Pradeep is back, so perhaps we can let Pradeep go finish.
Sure.
Pradeep, I'm happy to speak, but since he's back, Pradeep, are you online? No, okay. Shall I go ahead, Aisha?
Yes, please. Thank you.
Okay, so you asked about quality, right? And you asked about quality in low resource context and what is quality. So I think first I need to say there is a global consensus that we need quality. Okay, there needs to be equitable access to quality, and both Rukmini and Pradeep have really nicely highlighted the disparities, right, in wealth across regions. Pradeep was talking about differences in parental education and access. Okay, so one thing is we know that there should be equitable access to quality. So it shouldn't be that rich children are going to quality programs and poor children are going to not so good programs. Okay, so there's a global consensus. But you asked me what is quality and how do we deal with this in a low resource environment. So as you know, early childhood educators think about quality in terms of a couple of dimensions, right? As you mentioned in your slide, we talk about structural quality. Those are things that are typically regulated by the government, like the setting, the teacher qualifications, the teacher-child ratio, and the process quality, the interactions, right? So they're both important. The structural quality, that the setting should be safe, and the interactions. So what do you do in low resource environments? And can you said, should we have increased access without quality? I would say no. Okay, the consent if they didn't go. So if they're having a stimulating home environment, we do not want them to go to an unstimulating early childhood center. Okay, so that's the that's very clear. So what would you do in a low resource environment? So I would say the first thing is we invest in teacher training and professional development. I think we know that this is really absolutely the key. And I think they're doing this in the NEP. The next is developing a strong curriculum, right? So these are, this drives the pedagogy, right? So you really need to have what we call a holistic curriculum. It should not be a downward extension of primary education. It should focus on all areas, social, emotional, physical skills. And we know, right, more and more that these socio-emotional skills are really quite important. If you go to a standard one, a primary one teacher and ask them in your class which children have gone to preschool, whether it's Anganwadi or LKG, and which have not, they can tell you, and they'll tell you it's really the socio-emotional skills, learning about turn taking, putting up your hand, etc. Okay, so the other thing I think that's really important is that we really have to establish clear quality standards for programs, right? So what is acceptable, and we actually have to make sure that these standards are adhered to. And I guess two more things. One is allocation of sufficient funding. Quality is expensive, even in low resource environments. Quality is expensive. So it has to be, you talked about the political will, right? It needs to be a priority. And of course, as you know, from your own work and from other work, we need to have a systems perspective where we prioritize policy, governance, and finance. So it works together. So it's not enough to have the standards. In 2013, India developed really good quality standards for curriculum for programs, but I don't know how well they're monitored, how well they're implemented, whether all programs follow them, or is it just the government programs? Are the private schools monitored? What we call the non-state actors, are they following them? Are the NGOs following them? So that I would say, those I would say are the sort of the critical factors.
Thank you so much. And maybe that's a good thing, good point to turn back to both Pradeep and to Rukmini to say what right now in India, how well is the implementation happening? And secondly, what kind of evidence or key questions do you think we need to be asking through the research in India to build on the case for not just improving access, but for what quality will look like across all services? So I'm happy, maybe Rukmini, you can start, and then Pradeep, please to add your insights as well.
So, Aisha, I'll just give some examples from working with the government in this space in several states. These are the states that we know better because we're actually working with the government. So several different types of cases. The first one I would say is our experience in Punjab and in Himachal. These are both states which have traditionally had very high private schools for the primary grades and for the elementary grades. And if you look at their data, you will see that children start going to private LKG, UKG type of situations, from age 3 onwards, and we don't collect data actually lower than age 3. So I can't say what happens before 3. Now, a couple of years before the new education policy, I think there was a sense that this early childhood years are going to be important. And in both states, conversations started. In fact, ASR data was quite instrumental in that, in one particular way, that if you have children coming into school, let's say into first grade before age 6, then what does that look like? Because in first grade, we can actually pick up very simple learning outcome from ASR. And what we saw was that if you looked at the split between private and government, the children who went into private schools spent certainly 2 years, sometimes 3 years in lower KG and upper KG and whatnot. So by the time they came to grade 1, they were substantially older than the kids who were in standard 1 in the government schools. So if you were a parent who has high aspiration for your children, which is almost every parent in India, and you wanted your children to get as much schooling as possible, and you couldn't afford to send your children to a private school, then you push to have them in government school early. And you could see this very clearly, that age of entry into first grade was very different in both cases. And as a result, if you come into formal education too early, you start with a disadvantage which continues throughout. So this realization, and also partly because government schools were losing enrollment to private schools very early, in the preschool years, both state governments went ahead with putting in pre-primary grades into their schools. And I think it made sense because of the particular context in which they were operating. And there we see, both in Punjab and Himachal, over the couple of years before COVID and after COVID, that they've gone about strengthening their pre-primary grades in many different ways. For example, Himachal doesn't have dedicated teachers for pre-primary, but their schools are very small. So sometimes you only have 10 or 15 children in this 4 to 6 age group. And so what can be done for that? And Nirmala, I think this is the practical implementation that is taking place in different states is very interesting. Because what Himachal has done is they've invested quite well in a pre-primary cadre for academic support. So while the reality is that, getting teachers to populate pre-primary officially from the government side maybe will take some time. Although even at the local level, schools sometimes make arrangements for having a pre-primary person who is hired by the school management committee. This is very varied, but they have a cadre that will visit and support the pre-primary activities. So in addition to teacher training, I think there is that, and of course, appropriate materials and so on that happen. So this is the case in Punjab and Himachal. We see in, for example, a state like Haryana, which has really gone all out to improve the early childhood education part in their Anganwadis. And there, for example, they have done a whole bunch of things. It started with strengthening the co-located Anganwadis and making a bunch of them, they wanted to call it play school. Again, it is, I think, interplay between parental aspirations and what the government system can actually provide, given the fact that even in Haryana, private school is a big player in this sector. And there they have done a lot of different things, from starting with better infrastructure, better materials. But again, I would say a key component in the Haryana strengthening of Anganwadis for early childhood education is a creation of a support academic, or at least a pre-primary, whether I don't want to call it academic because they do a lot of other things as well, but really looking at this breadth of skills as a continuum that can be supported in the early childhood space. The play schools or the model schools are getting more attention, but I think overall the Anganwadis are getting training and materials. And the interesting thing in Haryana is this is being done jointly by the DIETS, which is the teacher training institutes for the school education, and the Anganwadi system together. I mean, this convergence has lots of issues, but at the ground level, there are certain things. And I want to give one more example, which is a very different example from Andhra Pradesh. So Andhra Pradesh has a conception of what they are calling a foundation school, where they want the Anganwadi and grades 1 and 2 be in the same physical space. So you can have the continuum right there. They want the teachers for Anganwadi as well as the teachers for 1 and 2 to undergo a similar kind of training. So it's the continuum from the early years to the first and second grades can actually be much smoother. They want to put, of course, the Anganwadi training will be slightly different than the first and second grade. And again, a whole team of people who can support this. I think that is a very key part of improving quality, because over a period of time, this is going to get stronger and stronger. And their idea is they want to move the third grades upwards into the middle schools. So that because this foundation school needs to be very close to the children's home. But you want the grades 3 and above to get more teachers, more other kinds of academic support. Now, these are 3 different cases, but I wanted to use this to say that and these are the cases I'm presenting is because we are partners with the government in these, so we are able to see year on year what kinds of things are being done. But the examples are important because, again, I think that, getting away from this one size fits all to what does my state need, where are my resources, what can I bring together? And also, I think that the other thing that is important is, at least in these 4 states, it's seen as a long run transition. It's not like in 1 year things are going to change. So the planning is happening, over a couple of years, where you're able to achieve some things this year, then you will add some things next year. And we have been working with all these governments because assessment or whatever measurement of quality is an important thing. And I think along with that, there is this view that parents also need to be educated, that preschool is not numbers and letters and is not twinkle, twinkle, little star, but there's a whole breadth of skills which are very important. And so, for example, again, as a simple example, these holistic, we are calling them continuum report cards, which actually give you these 5 domains, and the fact that it's a continuum, it's not like every child is, moving at the same stage. We've seen a lot of acceptance within the governments for such kinds of, thoughts coming in. So things are not perfect, but I at least am very hopeful because I see states thinking little differently given their own, their own context about what can be done. And states also, I feel, being open to this idea that anything you do in the classroom needs long run support. Training is, according to me, step 0. There needs to be a ongoing, continuous, and to the extent possible, your trainer should be the person who also provides on-site support. And I'm beginning to see that this is happening. Everything in India, and I'm sure everywhere else in the world, could be better than what it is. But the directions in which we are moving, I feel, are very, are promising. And we, as a, kind of a third party, are learning a lot from these varied experiences. And we are able to say to Haryana, by the way, Andhra Pradesh does this, or to a Punjab saying Himachal does that. Because I think this state-wise sharing at district level, at block level, often is difficult. The top people meet in Delhi for meetings, but the ground level sharing of how do you work this out, I think needs to be done much more, because that's how we will develop our solutions. So this is at least a view from the government sector from these couple of states.
That is so good to hear some of the different examples, but also a way forward in terms of the importance of sharing examples where people can see what is relevant to the context in their state and how they can think about this, not just, as you rightly point out, in the immediate or short term, but have a plan over a medium to longer term. I also appreciate that you highlighted the importance of having parents on board and thinking about what does a successful, good quality early learning space look like. And so, Pradeep, I know that you've done a lot of work in thinking about what are parents demanding from early childhood education services, what choices they are making. And I just wonder if you could flag a few of the key learnings from that work on the parent demand, the parent choices.
Thank you. No, this sort of idea is very clear that after this NEP particularly recognized the importance of EC, there is a momentum in India, what Rukmani was saying in many states. But what I find, there are several jargons which needs to be clear. Not very fast we are able to do, but at least that should be clear. One is this interministerial that confusions, like Anganwadi centers are Ministry of Women and Child Development. Then preschooling in government schools are with Ministry of Education. So there are some kind of confusion happens, and it's an important point to be noted at the policy level, and that should be clear, because when we are at some point of time, there is a story on mixing like.
Okay, I think we will come back once his connection is restored. But I think I will go to Nirmala, because I think Rukmini talked about a few different things that are happening across states as concrete examples of thinking about quality. And one of the key areas, of course, in thinking about quality is teacher training. And I wonder if you could share from your sort of work globally and also in India, what do you think are some of the kind of strong models or examples of not only immediate training, but also the support that teachers need in order to maintain those skills?
Sure. Thank you so much. But can I just respond to something that Rukmini said, which I think is absolutely right. And that is the sharing of noteworthy practices across the states. That is absolutely critical, because this is one thing. We may have low resources, but they're really, really effective ways to improve the quality of services for our children, where we can share what's been done in other states. So I just want to say that I think that's really, really important, and that's something that's really been highlighted internationally, the sharing of, really good practices across borders of states, across, so that's really, really good. So let me talk about the training. And the other thing I want to kind of reinforce, I mean, I talked about teacher training, but I work in education now, and we talk about continuous professional development. Teacher training is not a one-off thing, right? And what we've learned, and a lot of the work that you're familiar with, from Chile, from here, from there, is the importance of coaching, right? And it just doesn't stop at once, especially now with technological changes, etc. So teacher training is not a one-off thing, right? It's a continuous aspect. So what do we know about what we can do? I'm talking from some of the lessons that we've learned from global settings. One is the training has to be tailored to the local context, right? Aisha, from the work that we did for DFID a long time ago, how for community-based early educators, how establishing relationships is so important. In maybe India has gone past that stage now, but 20 years ago, it was really important for the Anganwadi teacher to actually build demand for the child to come to the Anganwadi, right? To build a demand for services, right? So I think we know the local context, whatever the issue is, that the teachers, Anganwadi workers have to be able to, we need to train them to work in that context. So there is the other lessons, coming out is we need to focus on content, knowledge, and pedagogy. So in the initial training, we know that not everyone is going to have a BEd. I know that the NEP is talking about a BALED, a BA, but it takes a long, long time to do that, right? So, many low and middle income countries have short-term programs. I think even the Anganwadis, initially, they have a residential program for short term. It's not a one-year program, right? I mean, so we need to focus on content. We need to focus on pedagogy. Teachers need to understand child development. They need to be able to do that, right? So we need that curriculum. We know it's really important in the training to provide practical hands-on experience. So it's no point in just having theory, this is philosophy and this is educational psychology. Good training has to have a practical component. They have to go into schools and they have to be supervised by experienced practitioners. We know this. So, and of course, as I just started by saying, we need this continuous professional development. Coaching really helps. And I just want to add one thing. It's not only the teachers, it's the leaders. We know that what we call the center in charge, okay, but you know what I mean, the principal, the kindergarten director, the head of the training of that person is really, really important. So it's the leaders as well as the teachers on the ground that need this training, continuous support, and continuous development. I think this is what my sense is, yeah.
I really appreciate that. And I really appreciate the emphasis that this shouldn't be the teacher's burden alone, that a one-off training isn't going to ever be sufficient, no matter where you are in the world, and it needs a support system around the teacher. And so in a scenario where we're seeing progress in equitable access, we're seeing great examples across states of building inequality, Pradeep, I want to come back to you and see, how do we bring parents along in that journey? What are the choices parents are making, and how do we support them in their understanding of what early childhood education can offer and its importance?
So, the idea was like this. So when we connected with this, the expansion of EC is happening, there is an expansion in the private place also, which is an important thing that we should acknowledge. That it's not only that we are expanding Anganwadis and all, that is anyway there, but there is a market for pre-primary schools. And that is what the focus point we should bring in. Why it is? Because parents are to some extent are confused. Not to some extent, I would say to a larger extent, they are confused. Because the people, like the parents from well-off families and particularly from urban settings, they try to get into the idea of these private preschools. And about the private preschools, they have the least. So they have the least knowledge about the private preschools, but they again enter into that. So in that context, there is a clear information asymmetry that exists, and there are lots of studies on this that says that there is a clear information asymmetry between what private schools offer and what the parents are looking for. What Rukmani was saying, there is a good amount of aspirations by parents, but that aspirations, how it is being fulfilled by the private schools is not, the story hasn't come out yet. So in most of the cases, the stories are coming up like they are being exploited to a larger extent because they are paying a lot, but what actually they are getting is not clear. I want to focus on two things particularly in this context. One is what is being taught and who is teaching. So these are two important questions in the pre-primary schools. Why? Because it's not about the inequality that I said earlier, about the inequality in access. It is also about the inequality in experiences. Because the inequality in experiences matters the most. You are getting into a school or you are getting into Anganwadis, but what you learn, what is being done there? In many cases, because it's what we call it's an open space. So Anganwadi, what is happening is clear to many, not to a larger extent, but to some extent. But what is happening in private preschools, none of us are clear. There are many private preschools which are operating in a closed space. Even sometimes parents are denied to interact with the school authorities. And that's where the system that works. There, the problem lies. As I think Nirmala was saying, we are not nowhere in teacher training. I don't see many teacher training institutes in India which train teachers for pre-primary schools, teaching to pre-primary section. So there also, what kind of teachers are being recruited, particularly in low-fee private preschools. So that's an important thing that we should bring in, because there is a huge demand for it. There is a huge aspiration among parents. At the same time, the market is expanding because there is a growing enrollment in private preschools. On the other side, we see that we have huge information asymmetry. We don't have much knowledge about what they are doing. So that needs to be understood, not necessarily at the private space, not necessarily at the this parents level. It is also at the policy level. This should be thought. That's my idea. That I'm getting into the kind of the regulations that we are putting for private schools, and I feel that there should be a strict regulatory mechanism for pre-primary schools, because that's the time when we are building the career of the brain of the child. So that's an important time for the child. If we are losing that, then it's very, very crucial for the country to get into the kind of thinking, kind of development track that we are looking for. It's very, very, I would say it is very, very difficult for India to achieve that. And this is an important concern, and we must get into a debate. But unfortunately, what we see, I think I'm ending by telling this last sentence, that unfortunately what we see, not much is being talked on that, particularly the aspect, that private aspect, because they are, to me, they are operating in an isolated space, which we are not able to look at. Even the researchers are not able to reach. You said about what kind of research is being done in Indian context, I said, so I'm responding to that. We have research on Anganwadi centers, many studies. I think most of us might be aware, but I don't see, at least I have not seen so far a good number of studies on private preschools. Because it's access to private preschools, it's a difficult task sometimes. Even if you are very close to the government, even you work in the bureaucratic structure, still there is a hurdle for them because they don't want to reveal their stories. So that's an important point. We don't have research on them. We don't know what they are doing, but that is expanding. So in which direction we are getting into in the expansion of private preschools is an important concern. It's an important concern for academic. It's an important concern for policymakers. And all of us, who all have joined this webinar. So that's an important, and that's one area that I'm looking for. What is happening in that, and how they are meeting the parental aspirations in that context. Thank you. I'll be back again. Hope my internet will work soon.
Thank you. That's such helpful insights.
Aisha, can I add something to what Pradeep has said? I agree with Pradeep that, when we look at, let's say, if I want to think about every child's exposure and experience of preschool, then we need to look at what is happening at home, what is happening in private school, and what is happening in Anganwadis or in government schools. The study that we were able to do with Ambedkar University, I think is quite unique in that sense. For first thing, it's a longitudinal study. It went from 2011 to 2016 and actually followed these cohorts through this journey. The Ambedkar University was able to do much more qualitative work on what is exactly to the question that Pradeep is saying, what was happening in these centers. And we were able to actually do a more quantitative work on looking at tracking the cohorts. Now, one thing that came out from that study was that if you looked at private NGO kinds of pre-primaries versus Anganwadi versus private schools, very interesting if you looked at actual time spent inside these three different types and what was going on, you saw that the private schools, which were largely rural and probably fall into the low fee type of schools, was very little time given to many of the things that we think are very important for this age group, and a lot of focus on numbers, letters, English, and such things. And so therefore the fact that private schools actually offer preschool all the way up, I think sometimes has this downward trend of taking things that are important in higher grades into the preschools and too early. Whereas Anganwadis, compared to that, Anganwadis, even though they spend less time on early childhood education, there was much more free play. There was much more, relatively speaking, the kinds of things that we think are important. So I completely agree with Pradeep that I think both things are important. We need to look at what is happening actually at the point at which instructional or group activities are happening in different contexts, and be able to track changes over time, because these are all investments which are being done early, and how do they pan out as they go ahead. But if I can take 2 more minutes on what we see on the parental front. So I think that, again, I often think that we are at a very interesting juncture, both because of COVID and because of the new education policy. During COVID, anything that happened was really done by families. Whatever they did was really families, and to some extent, siblings, communities, that's where the action was. And I think that that experience across the country, across all types of families, brought people into, earlier, I think even upper class families would say, I'm going to spend on inputs. I'm going to send my child to a very good school. I'm going to send my child to very good coaching. I'm going to buy lots of nice things. So input orientation to improving education, as opposed to engagement-oriented support to learning. And I think we all got a big dose of what that means at one's own level with one's own resources during COVID. And I think the COVID experience and the fact that schools were closed in India for 2 years also brought a lot of realization within government systems that this piece outside the school is very important as well. So a couple of things that we noticed. One is that in most places where we are working, so we have quite a large direct work within communities within Pratham, where we work a lot with mothers and mothers groups. So there is not just mothers and families who are important, but we see that if you do mohalla-based mothers groups, they meet frequently, once a week, once every 10 days, and they do little activities which can be done at home or anywhere else, which don't need much materials. We've been doing this during COVID because that was the only thing you could do. But we now find that that's as important as the instructional stuff that is happening inside the schools. And in many of the governments, bringing these groups closer to the Anganwadi or the school has been welcomed by the governments. So for example, in Maharashtra, statewide, all Zilla Parishad schools now have mothers groups for first and second grades. And in many cases, these mothers and teachers will meet once a month to do actually activity workshops together. We see this in Punjab. Himachal has launched a whole other program to bring mothers, they call it Ma Pehli Shikshak, a whole year-long program to involve mothers in all of this. These are very interesting new developments. And I think what this is doing is firstly valuing that the family matters and that the family needs to be along on this journey, not just paying fees, but actually being engaged in what happens with kids. And within this, we also see that the more you work with parents on the fact that a breadth of skills is important as a foundation right now, not very academic, not just academic ones, the more concrete examples that can be provided through these mother workshops, through actual activities that can be done by the mothers groups, the more people are open to the idea that actually this foundation needs to be built on a very broad. So again, and you may say that I'm unnecessarily optimistic, but I feel like these are big shifts in mindsets, both at a family level as well as at a government level, to say that we need to engage families in learning, not just in schooling, and we need to create ways in which this can happen. And the second one is that it's not just academic. I mean, it's not just these, reading and math, but it is cognitive and socio-emotional and, physical, which is also really important. We see more of that, at least beginning to come in at a training level, at a activity level, and the more supported this can be provided, both to the parent stuff as well as to the school stuff, I think will go a long way.
I think that addresses some of the questions that the audience is asking, really, which is about this engagement of outside of the school, right? The engagement of community, the engagement of mothers, other caregivers in really supporting the child. And I think there's a great examples, and it's important. This is hard work, and it's important to have the optimism to keep going. And so I want to take this time now to turn to some of the questions. There's a lot of questions from the audience, but I want to highlight a few questions for the panel. And the first is really about the importance of teacher training, which has been recognized across the panel. And I think specifically for perhaps either Nirmala or Rukmini, one of the questions is, how does the country really accelerate teacher training at scale to ensure that we can keep up with what the need the NEP lays out? And that ensures that there's still great bachelor programs or more skills-based development within the national policy, and how does that really also engage not just the public sector but also the private sector?
Rukmini, you go ahead.
So I would say, the ASER 2022 asked a question. While the household survey, the survey is largely households, we also visit a primary school in the sample village. And so remember, this was September 22, when schools had only been open since April roughly, or, plus minus some months. And we asked a question to the teachers saying, have you had any training on the new education policy? And has any materials, because there's a lot of materials also that Nipun Bharat is bringing in. Very high percentage of teachers have already received some training. So I think this indicates that the seriousness of, at least at the policy level and at a very broad macro practice level, to say that if we want to bring about all these changes, then teachers have to be at the forefront of where we are bringing it in. Now, did every training happen in the best possible way or not? I think, there must be a lot of variations. But the fact that this training was not only like done on remote or on, through, online stuff, I think is significant. The other thing I think very visibly that you can see across all states is that one more thing is that the new education policy, the actual national curriculum framework and the Nipun Bharat part of it was released as quickly as possible. They did not wait to do the whole national curriculum framework from early grades all the way to 12th, which is usually what is done. The early years part, the foundation stage, from early childhood to grades 3 was released quickly. Similarly, I think there has been a big push across all governments to actually put the materials, it's called Jadu Ka Pitara or different things in different states, arrive at the school. I mean, this year, there is a lot more materials in most states in at least the early grades. The challenge of bringing ICDS and schools together remains, but I think it's being worked out in some way. And a third thing I think that has happened is that states have become quite tight on age of entry into first grade. I'm saying all this, that it's not just teacher training alone. I think it's this set of things that are happening, which is giving priority to this age group. And at different levels, I think, how much So, for example, at least in the education department in UP, they are investing heavily in what I would call this academic support cadre, not leaving it all just to online or whatever. So different states are doing this differently. Andhra Pradesh, for example, we have been working with the state to develop this 120-day training package, which first the lead trainers will have to practice before it can go to the states. So I think teacher training at the preschool stage and at the early grades, I think there is a new way of looking at it. And the more we look at it closely, the more feedback that comes, subsequent rounds can be modified. So I stress, whether it's research or otherwise, this is a long run game. If we consistently operate on this, things will change. Another major development in the, I don't know whether to call it policy or practice or somewhere in between, is that for the first time, India is doing 2-year planning as opposed to annual planning. Now, this is a big thing because otherwise every program within the education department was done 1 year at a time. And you have to go back with your annual work plans to get the sanctions for the following year. This now we have a 2-year window. It's a small thing, but a very big thing, because then you can actually plan over time to do this.
Thank you. Nirmala?
Yeah, I just want to say, training is so important, and, the government has a very important role, but sometimes the government institutions do not have enough capacity. So you have private providers coming in, right? But there needs to be a monitoring of the quality of training as well. Just like we have to monitor the quality of the services that children receive, the quality of training, whether it's provided by the government or a private provider, it needs to be of sufficient quality, and it needs to, have those characteristics that I mentioned before, having, addressing the curriculum pedagogical approaches, having a practical component, etc. So if we're building a system of high quality early childhood, we need to have sufficient teachers, and we need to build the infrastructure, right, to increase equitable access. So teachers are such a critical part of that infrastructure. We need more teachers if we are increasing our GER enrollment ratio or our access. So I think we need to deal with this. I know that, the growth rate is not as much as it was. So sometimes they retrain primary school teachers, or because you don't have as many classes. But I think we need to be very cognizant of the fact that we need more teachers to maintain teacher-child ratios where children are getting attention, right? Yeah.
Thank you. Another theme that's coming up from the audience, and perhaps I'll direct this to you, Pradeep. We've talked a lot about the role and the importance of the Anganwadis, but one of the questions here is how do we shift some of the focus in Anganwadis to not only think about nutrition or their role in ensuring vaccines and health, but to also focus on the early childhood care and education component?
Very interesting question. Because one interesting hope to go ahead with this implementing this early childhood education is Anganwadis, because that's present in many places. They are doing well, functioning. Many cases they are functioning well. That's what the story tells. Functioning well in the sense not on education component, but in other components. That's my understanding, and what Rukmani was saying, because she knows about the ground, that in some cases they are also doing good in the early education, giving education components. There are empirical studies. I think Karthik Muralidharan did a study on randomization study, and he brought out that, and a group, they said that adding one more worker to the Anganwadis will work very effectively. Because now in the current system, we have one Anganwadi worker and one helper in each Anganwadis. So they are not enough. There is not enough manpower to operate at a large scale, like getting into
like getting children into school, like to the Anganwadi center, then giving them food, then other aspects like health demands, fulfilling their health demands, and then getting into education. What I find by my intervention, because I visited a couple of Anganwadis in Delhi as well and in Odisha, and I found they prioritize the education component. They don't prioritize the education component. They keep at the bottom. That's what my experiences of visiting many, and that's many also that have come up saying that they prioritize many other things and they keep the education component at the bottom. So if we are actually now getting into through NEP the provisioning of this early education component, so we must strengthen the Anganwadis in that way. And one important way that I just said is increasing the manpower. And the other important thing that I feel we can do, the government can do, is giving little more training to Anganwadi workers. Because giving more training to Anganwadi workers to teach the children might work, because they are not, none of them are as kind of the, none of them got formal training to my mind as such to teach something to the younger children, because it's very difficult to teach younger children what to teach, how to teach and all that. So they also find it very difficult. When I visited a couple of Anganwadi centers and when I interacted with these young children, I found one story very, very clearly, and it came repeatedly in many Anganwadi centers, is the kind of stories and other things they do, they are very repetitive for the children. So once they become repetitive, every day in the morning you go for that, what twinkle, twinkle, little star and all that what Rukmani was mentioning. So that actually that doesn't contribute a lot to children's cognitive skills. I was so happy to see that even Assar is providing many interesting documents to a few Anganwadis in Delhi that I found in my visit. And they showed many interesting storybooks and all which were being circulated to this. The other interesting thing this with Assar they do, I found that should be scaled up, is about the calling mothers to the Anganwadi centers. And then telling them how important it is to sit with your child, giving them storybooks, giving them tablets, like the iPads, and helping them to tell stories at home. So it's not that everything you will do with your child only in the Anganwadi center. You can do many more things at home. So that way, if you train the parents, at least particularly the mother, then that will contribute a lot to the cognitive skill of the children. And these are small experiments that are being done. And if government scale up all those, then that would effectively work. And I find that those are very interesting instruments to scale up the work, to give quality early education to the children through Anganwadi centers. And the larger picture that we are bringing in, merging them to schools and all, that is also happening in many places. That should be continued. But at the same time, we should strengthen the Anganwadis through this not small, but very effective ways by which the children can learn better through the existing system. That's very, very important. Because we can't rely on the private preschools, many, because we are not sure what is happening there, one thing. Second thing is they are very costly. So you can't ask the marginalized group, let's say lower caste, poor economic students from, like children from poor families and all, to access those private schools. So in that context, we can't see a market, like we can't connect market with them. So that's very difficult. So we have the best hope that we have is the Anganwadi centers, and it's high time to bring changes that I just suggested a few. There may be many more. The others, Rukmani and Nirmala, might be doing more of such changes that can be brought in the Anganwadi centers, which will definitely bring great learning to the great and quality learning to the children, to these small children, I think, and India will prosper us in that way. And we are looking for a developed India in 2047. So these are important things, because early human capital formation brings many changes in the economy and society. It's not necessarily only with children.
Thank you. And, across this discussion, we've talked about issues of equity, but one of the things that we haven't actually touched upon, and one of the audience members is asking, is what progress has been made in ensuring that early childhood education in India is indeed inclusive for all children, including, I guess, those with disabilities. And I wonder if Rukmani or others on the panel have any experience or examples they could share.
I think the area of young children and disability is a very open and much needed area. Obviously there are specialized people who are working in this, but along with the focus that we are seeing on early investments, I think large scale ability to look at early detection would also be a key part of this. Now, for example, as Pradeep, our Asar is only our research part. The things you're describing are what Pratham does. But even us, as a mainstream organization which has worked with both preschool and primary school children for a long time, it's only very recently that we have the courage to kind of get into this space to start understanding what does disability mean. Because at least to us, it seemed for a long time, this is a very daunting thing. You have to be very specialized, even in diagnostic or early detection. You don't want to, label people too early. And we were kind of staying away. But last year we decided and we applied for a grant to say if mainstream organizations or mainstream departments don't take this on, then we'll always think of this as a difficult and a specialized activity. So I do think it's a very important area, and the sooner, and here is one in which Anganwadis or preschools working with families is very important, because very often when children have some kind of a disability, you tend to kind of put them in a different bucket and don't feel that they can be integrated into whatever is happening in the neighborhood or what's happening in the school. So very important question, no good answers, but I think efforts in this direction have to be speeded up. And just as people, we care about children, we shouldn't be frightened to think that I'm not capable of thinking about disability. I think we have to jump in, and only then we will start, because we need this kind of understanding to be very broad. In Pratham, one of our taglines is every child in school and learning well. And while we try to reach every, even we have not reached that every, the one that needs special attention, because we've been worried that you need to be specialized, which we do. But I think it's from interacting with specialists that what common and ordinary people can do will come out.
Thank you. That's it's incredibly important to flag what we still have to make inroads in. We're coming up to the end of time, but I want to give each panelist the opportunity, perhaps just to highlight very, very briefly, what are your final thought in terms of if you want to prioritize a key action over the next 5 years? What would that look like? What would that be? And perhaps I'd start with you, Rukmini, and then Nirmala and Pradeep.
So, I'm just going to repeat myself. I think we've reached a very interesting point in our own history. The fact that now we have a big national priority which says build the foundation skills well. So as people, not just people in this sector, but I think as a country, we should embrace this opportunity. We have 25 million children in each age group. So if I look at this age group from 3 to 8, that is probably 120, 150 million kids. They are our destiny. And so if anybody was listening to me, I would say invest heavily for the next 5 years in this 120 million if we want a better century for India. And there as well, I think simple things like the fact that everybody can contribute in this breadth of skills. We need to think about this as a continuum, and we need to involve everyone, families, communities, and teachers, as a way to get this ahead. Just really democratize the participation in building our young children's current, foundations and future. It's a, I don't know what the rest of the world is like, I don't know, but I think we are in a very exciting space in India, but we must embrace all the opportunity and work with the resources we have and build the capability that we need to have. Resources will follow. In a country of 1 billion+ people, we don't lack energy. So let us not hold back. That would be my message.
Thank you. Thank you for the optimism as well. Nirmala.
Yeah, so I would also agree that equitable access to quality early childhood for every child, right, is very important. But I think at the same time, it can't be just a statement. We need to invest in building structures and systems that support us to do that as well, right? So I think that's really we're hearing that there's political will, etc., that needs to continue, and we need to invest, right? We need to have the monitoring, the evaluation, the data like Asar is giving us. That's really, really important to move the needle, to get that governance structure, the monitoring structure. Yeah.
Thank you so much,
Thanks.
Nirmala. And Pradeep.
Thank you. So, like as an academic, I want to bring 2 points. One is, so far the discourse on early childhood education is largely at the national level. I see that what India is doing and all. We need to create micro level evidence, more micro level evidence, particularly at the sub-national level. How different states are doing. I think today I got a good impression from Rukmani what states are doing. So we need to create more evidences on what states are doing, what are their strategies, and then learning from each other's. Because that is an important component. If Himachal is doing well, then Odisha, for instance, is not doing well, then it's an important thing to find out who is doing well and what can be learned from them. So that mutual learning at the sub-national level and producing new evidence who is doing what is an important component, because that will accelerate the process of development in the early childhood education, which is an important discourse that we all are doing today. So that's an important point, that one is generating evidence, new evidence, what is happening in the field, and learning from that evidence. Cross-state, cross-cultural learning. That is first point. My second point is, we should be little careful about the expansion of the private sector. Again, I am repeating myself to some extent, because that's what is seen in the current context. And there, the market is capturing many things. And one of the reasons that we are not providing good quality preschool, government preschools. So far, it's happening. Now we are getting into that direction, but market is going ahead of what actually we see in the government sector. So they are creating a chaotic situation in the system. As a result, many parents, even lower middle income group, now poor families, they are also being exploited. I want to give one example. For instance, government is making the entry for grade 1 as 6. So what is being understood in the field, many are arguing this is giving more time for the private sector to exploit the parents. Earlier, at least the poor parents, they were entering the government schools at the age of 5. But now 1 year more they have increased, so they will be entering 6. So then for the parents, they are thinking to not to keep their children at home, rather sending to maybe low fee pre-primary private school. So they are getting another scope to exploit. So that's another thing one must think about, and in that line, what I'm trying to say. So these are the 2 important points. One is generating micro level evidence, learning from each other. Second one is keeping an eye, regulatory eye on private expansion, which is very important for us.
Thank you. And with that, I would like to thank all of the panelists for their insights, and just to say to Monica and colleagues that clearly by the audience's response and the questions, there's enough here for a series of talks.
Well, thank you so much, Aisha, Nirmala, Pradeep, and Rukmani. It was such a deep and insightful conversation. You talked about different aspects of the field. You covered different stratas of population, the research policy and practice side of things, talking about the market-driven aspects of preschool education, access, quality, cost issues, the inequities involved, the importance of teacher training, parent awareness. I don't think I have like more words to add to what you've already spoken, but I really want to pass on my sincere thanks to all our panelists and definitely our wonderful audience, like Aisha mentioned, for making this session so insightful, so deep in the conversation. And definitely a big thanks to the Mittal Institute team who's sitting in the background, who put together this session with a lot of hard work, Amit, Angarika, Shreya, and Sushma, and also Khushbu from the Harvard School of Public Health India Research Center for joining hands with us for this webinar. Thanks to Professor Vish for also agreeing to be part of this. But I think I want to just close in interest of time, wishing everyone a great evening or a day ahead, depending on where you're joining us from. Keep in touch, all of you. We have a lot of our social media handles, our website, our email. Angarika will be happy to share them in the chat window. But thank you again. Really a big thanks to all the panelists. It was really, really very, very deep and moving conversation. So thank you so much again.
Thank you.
And thank you, audience. Keep in touch. And we'll come back again with another session, like Aisha mentioned. There are so many in making, I feel, from this conversation itself. Many issues, many conversations to be making. Thank you very much.